HHS and FDA employees who are waiting outside of a building and tapping their badge to see if they can get inside that building right now. And if that badge turns green, they are still employed. And if that badge turns red, that's how they find out that they've been fired. FDA employees are not just this kind of vague idea of a bureaucrat. These are scientists. These are individuals responsible for assessing what can come to market and what can also be brought over the counter. And in fact, just last week, we received notification that the Trump administration will be cutting 3,500 employees from the FDA. A skeleton crew.
So Donald Trump has broken every single promise he made on the campaign trail, and only the first 100 days of his administration prices are up. There is no end to the war in Ukraine, but one promise that he has broken, which isn't getting enough coverage to me, is this idea that the guy who put away 5 McChickens a day alongside the vaccine skeptic who sounds like he's swallowing sand was somehow going to make America healthy again. And that promise, which has very clearly been broken, is re-emerging with some new news, a new scandal from RFK Jr. that AOC was grilling him for. We are going to get into it all. But before we do, if I could quickly ask you to leave a like on this video, and if you haven't already and you enjoy our channel, to hit that subscribe button. It goes a long way. And it really does mean a lot to me now. Before we get into AOC's takedown of the Make America Healthy Again movement, I want to start with this breaking news about RFK Jr. RFK Jr. caught lying about new surgeon general nominee RFK Jr. is just making stuff up to justify his choice to nominate wellness influencer Casey Means health secretary. RFK Jr. is lying about the qualifications of his pick for Surgeon General during an appearance on Fox News. Thursday night, Kennedy attempted to defend his choice of Casey Means, a wellness influencer and author who has no medical license and never completed her physician residency. But as is typical for the anti-vaccine conspiracy theorist, in lie of evidence, Kennedy just made stuff up. She was the top of her the very top of her medical class at Stanford. Kennedy said during her residency, she won every award that she could win. She walked away from traditional medical licenses because she was not curing patients. She couldn't get anyone within her profession to look at the nutrition contributions to illness, Kennedy said. But it would have been impossible for Means to be at the top of her class at Stanford Medical School because students aren't actually ranked there. A spokesperson from the school told CNN's Daniel Dale that medical students are graded on a pass-fail system. Kennedy's claim that Means quit her residency to walk away from traditional medicine is also untrue. Dr. Paul Flynn, a former chair of the head and neck surgery at Oregon Health and Science, who helped oversee Means during her 5-year residency program, provided a completely different explanation for why she walked away from it. After 4.5 years, she wasn't even sure she wanted to be in medicine. She wanted to do something different. She wanted to resign. Means was under so much anxiety that she was given 3 months paid time off. She did. That came back and decided she wanted to leave the program. She did not like the levels of stress. Flint said, there's a lot of anxiety around being a surgeon. You become much more responsible the more senior you get. He explained. Kennedy argued in a post on Twitter Thursday that Means's lack of qualifications were actually what made her such a great fit with his Make America Healthy Again agenda. It is incredible and incredibly scary. The rise of anti-intellectualism we're seeing in America, and that is so pervasive in the MAGA movement. This is the attack on institutions that they are trying to carry out, trying to make us all weary of any government program so they can install cooks and crooks all throughout their government who will only be yes men to Donald Trump and his stooges. That is terrifying. And all the while, they are cutting funding to actual medical research, which is what AOC was calling out in this takedown right here.
as these hearings are proceeding, not too far away, there are blocks and blocks of lines of HHS and FDA employees who are waiting outside of a building and tapping their badge to see if they can get inside that building right now. And if that badge turns green, they are still employed. And if that badge turns red, that's how they find out that they've been fired. FDA employees are not just this kind of vague idea of a bureaucrat. These are scientists. These are individuals responsible for assessing what can come to market and what can also be brought over the counter. And in fact, just last week, we received notification the Trump administration will be cutting 3,500 employees from the FDA, a skeleton crew. So, Mr. Faber, what do the employees at the FDA do when it comes to reviewing OTC drugs and medical devices?
Well, they do everything from making sure that these ingredients are safe, that is, that they don't pose any risk of harm, cancer, reproductive harm, neurological harm, harm to our hormone systems, as well as making sure they're effective, that they actually block both UVA and UVB rays so that we're not at greater risk of skin cancer.
And would cuts to the FDA's workforce limit the FDA's ability to review and approve new over-the-counter drugs like sunscreen, but of course many others?
Absolutely. If we cut the funding for people who aren't reviewers, that doesn't mean FDA won't be able to complete these reviews. All the other experts, the biostatisticians, the economists, the label experts, all of those people are part of a review team that make these sunscreens available to us.
And what are some examples of drugs that the FDA has been able to make available over the counter without a prescription in recent years?
Well, we've heard some great examples. Claritin, allergy medications, Opill, oral contraceptions. Narcan or naloxone has been a great innovation that's now available over the counter. Anything that delays access to over-the-counter products is a step backwards.
Absolutely. And for so many people, as was noted, not just in rural areas, but also in urban areas like mine, the added obstacle of having to see a doctor can prevent someone from getting really critical and important treatment for them. And to bring something over the counter can be just as seismic as bringing it to the market in the first place for a lot of people who have trouble accessing these drugs. And not only are these significant medical breakthroughs, but they make them more affordable and accessible. Mr. Faber, what could happen to products, for example, like baby formula? Baby formula is also regulated by the FDA. Many people may not know that some things that are considered an over-the-counter OTC or within the purview of the FDA are in the purview of FDA. And we saw a couple of years ago that there were shortages around baby formula. What could happen to products like baby formula if there are not enough FDA staff to review?
One of the reasons that infant formula was contaminated and that babies died was because yesterday we didn't have enough people to inspect food manufacturing facilities, including infant formula facilities, and they weren't being properly trained to do so. Today, by firing 3,500 people, we've made that problem even worse.
Mm-hmm. And, going back to that baby formula issue, there was also a market issue where there's been this shift in saying companies can review themselves, they can investigate themselves, they can investigate their own supply chains. And I cannot think of something worse for people than not having an independent investigator whose job is to be responsive to the public in order to verify that the safety of our food and drug supply is all right. Do you have anything else to add, Dr. Faber?
I'll just say this committee passed the Food Safety Modernization Act 15 years ago for two reasons. One was to make sure that we inspected facilities more often. And the second was to make sure that inspectors were properly trained to know what to look for. And we did that in part because the food industry wanted a partner at the FDA that could help them police these long, complicated supply chains. Today, we made the job of industry to keep our food safe much harder.
The focus of this administration couldn't be any more removed from what is important and necessary. It is terrifying, and it's not just that they're going after some of the most important elements of what government does, but they are using government to attack anyone who they seek to other or who want to marginalize. And that is exactly what we've seen a lot from House Republicans and what Robert Garcia called out right here.
There is some bipartisan consensus. Here's a quote from one of my Republican colleagues who's actually on this committee today, which I want to read. I find it encouraging. It says, "I strongly support LGBTQ rights and equality. No one should be discriminated against. I have friends and family that identify as LGBTQ. Understanding how they feel and how they've been treated is important. Having been around gay, lesbian, and transgender people has informed my opinion over my lifetime." Now, Ms. Cosgraves, do you know who said this by any chance?
I don't know.
This was actually Congresswoman Nancy Mace, who's, I know, waved on to our committee today. Now, Madam Chair, I'd like to insert into the record this article on CNN that says, titled, "Nancy Mace, now targeting transgender lawmaker, called herself pro-transgender rights in 2023. Madam Chairwoman?
Without objection.
Thank you. Now, Congresswoman Mace, of course, is here today. Now, in November of just last year, Congresswoman Mace posted 326 times on social media about trans people and their access to bathrooms in just one 72-hour period. That's a fact. So I'd like to introduce another article from Newsweek, and it's entitled, this is the title, "Nancy Mace has posted 326 times in the last 72 hours about bathrooms." Madam Chair, can I introduce this into the record?
Without objection.
Thank you. I point this out because it's actually important context. Republicans accuse Democrats of focusing too much on LGBTQ plus issues or trans issues. But we want to talk about protecting Social Security. We want to talk about protecting the cost of living. We want to talk about lowering prices. We want to make sure that all people have health care. But Republicans are so obsessed with demonizing trans people that we are wasting time in our Government Efficiency Committee talking about trans people that like fencing. Now let's remember, according to congressional testimony from the head of the NCAA, there are less than 10 trans college athletes in 2024. That's less than 10 out of 500,000 total NCAA athletes. Less than 10 out of 500,000. Now, Congresswoman Mace has posted about this issue hundreds and hundreds of times. That's equal to hundreds of individual posts per athlete. All the while, we're ignoring the real issues. I want to remind everyone that we've seen 935 confirmed cases of the measles as of May 1st, according to the CDC. Nearly 1,000 children are getting sick while our country is hit by crisis after crisis. Let's focus on the 930 adults and kids with measles versus the 10 trans athletes that are participating in college sports. It is obvious to the American public that this issue is being exploited by extremists to divide the American public. It's shameful.
Why on earth is the President of the United States, our elected officials in the federal government, trying to use their power to attack kids who want to play sports with their friends in grade school? Why is that the focus? It is beyond disappointing. It's beyond disgusting. It's not surprising. But this is what they do. They try to distract from the fact that they are failing by attacking people who do not have the power to fight back. And so we have to fight back for them. That's what we're doing on this show. And if you want to support that, as always, you can hit that subscribe button, leave a like on this video, and if you stuck around to the end, you drop a blue heart in the comments, and you can call MAGA Republicans weird, because that's what they are. And until next time, I'll see you soon.